students. So I will continue with the last topic. We were discussing about the cholelithiasis. Cholelithiasis. So it is a gallbladder stones, also known as gallstones, cholelithiasis. So the stone formations occur in the gallbladder. So here I am drawing the rough diagram. Basically the gallbladder is in green color, shown in green color, but I have blue color, so I am making. So these are the ducts, extrahepatic ducts. The intrahepatic ducts are in the liver. This is the liver. This is the liver, and here these are the intrahepatic ducts, and this is the extrahepatic ducts, and here is the gallbladder. This is the gallbladder. So this is the neck of the gallbladder. So this is gallbladder. Now here the stone formation occurs. Stones are what? These are pedal-like hard particles formed inside the gallbladder from the cholesterol, bile salts and the minerals. So basically gallstones are composed of bile pigments, bilirubin, minerals and cholesterol. Now in the last class I have already explained that there is excess of cholesterol. So the metabolism is the primary and the main factor that depends and that affects gallstone formation. Now if the patient is obese and that patient is consuming more fatty rich diet, more greasy and cholesterol rich, more fat rich diet, and that patient is consuming less fibers, so that high cholesterol consumption will lead to the excess of cholesterol in the body, and there is a ratio of 25:1 cholesterol and bile salts. This is the ratio of cholesterol and bile salts. But if this ratio drops to 13, if this ratio drops to 13:1, if there is excess of cholesterol, so I have already explained that cholesterols are not water soluble, and to flow, to travel into the GIT, the cholesterol is made or produced inside the liver. Cholesterol is produced in the liver. From liver it enters through the biliary system into the gallbladder, and from gallbladder it gets into the GIT, and from GIT it gets eliminated or excreted. So it is not water soluble, so it combines with bile salts and also with phospholipids. So there is another factor. When there is gene mutation of the gene MTR3. So this is a gene, and when there is mutation of this MTR3 gene, that will lead to the defective formation of phospholipids. So there will be defective phospholipids. So phospholipids combine with cholesterol to make vesicles, the micelles. That micelles then get excreted from the GIT. So these micelles are composed of phospholipids and cholesterol, because cholesterol is not water soluble, so it combines with phospholipids and then get eliminated or excreted. So there is defective formation or production of phospholipids because of the mutation of MTR3 gene. And when there is excess of cholesterol, then that cholesterol will combine and will form the cholesterol monohydrate crystals that will get precipitated into the gallbladder. Now in gallbladder there is excess of cholesterol. So imagine this is gallbladder and there is excess of cholesterol. So what? The bile, this is bile. So the bile is now supersaturated. The bile is now supersaturated. Now when there is excess of cholesterol in the bile, because the cholesterol is not getting eliminated because of the genetic mutation of MBR3, so it is not getting combined with the phospholipids, it is not getting combined with the bile salts, so it is not getting eliminated. So there is excess of this cholesterol. So this bile will become lithogenic. The bile will become lithogenic and then there will be supersaturation of bile because there is excess of cholesterol. Cholesterol is excess. Cholesterol is excess. So there will be supersaturation of the bile. Now when the cholesterol is in excess, then there will be nucleation of cholesterol. Now there is saturation of the bile with cholesterol. So there will be nucleation of the cholesterol. So the cholesterol will become like this. So there will be nucleation of the cholesterol. Now there are two factors, the promoting factors and the one which is inhibiting factors. So the factors which are activating the process of nucleation of the cholesterol are mucin. So there are two factors. These are activating or promoting the nucleation of cholesterol. These factors are mucin and glycoproteins. The another factors, this is promoting, okay? This is promoting or activating the nucleation of cholesterol. These factors are mucin and glycoproteins. Now there are some factors which are inhibiting the process of nucleation of cholesterol. So they are inhibiting. So these are glycoproteins and alpha-lipoproteins. So glycoproteins and alpha-lipoproteins are inhibiting the process of nucleation of cholesterol, and the factors like mucin and glycoproteins are activating the process of nucleation of the cholesterol. Now there will be crystallization of cholesterol. Crystallization of cholesterol. So this will come together and will clump. So this is the crystallization of cholesterol. Then afterwards there will be binding of this crystals together with the mucin gel. So the biliary sludge will be formed, and that's how the formation of stones occur in the gallbladder. So that's how the gallstones occur. This is the pathology. Now we have already discussed that gallstones are composed of cholesterol and unconjugated bilirubin because of the excess of RBC breakdown, and infections also lead to the formation of stones, and abnormal mucosa of the gallbladder also leads to the development of stones, because abnormal mucus will cause impaired bile flow. So the bile will be sluggish, bile will be stationary here. So when bile will get stationed here and it will not move, then that accumulated bile that is not getting excreted, that bile will form stones. And there will be, when the stones will be formed, then the stones will cause irritation to the wall of gallbladder, to the neck of a gallbladder. So this will cause spasm, irritation, and then erosion of the mucosa, and then the tissue planes will be get exposed to the detergent action of the bile salts, and the ultimate result will be necrosis and perforation of the gallbladder. Now the symptoms. Symptoms is, patient will come with a typical character of pain. That pain is called biliary pain. Biliary pain. So there is biliary pain. The pain is of characteristic feature. This is abdomen. Okay, this is the navel region. So the pain will be in the right hypochondric region. Right hypochondrium region. So it's an upper abdominal pain in the right hypochondric region, and that pain will last from 15 minutes to 2 hours. So it can last for hours, and there is spasm of the gallbladder. So that will cause a colically pain, spasmodic pain. So that pain is called biliary pain, and that pain is mostly in the night. Why? Because patient is in supine position. So during that position, when patient is sleeping, it is he or she is in supine position. So at that position, that stone will block the neck of the gallbladder and will cause spasm of the gallbladder. So because of that obstruction, that blockage that has been created by stone, so there will be spasmodic pain and colically pain. And accompanying other features will be nausea. Vomiting is because of reflux pylospasm. There is spasm of body of the sphincter. So there is nausea, vomiting, along with there is belching, heartburn. Then there is anorexia, fullness of abdomen, and vomiting, nausea, belching, heartburn, dyspepsia. And if the gallstone has created infection, because we have seen in earlier class that the gallstone can cause proliferation of the bacteria, and there could be the formation of focus or needles in that area. So if the infection is there, then patient can come with the symptoms along with as fever, vomiting, malaise, body ache. So these are general features of fatigue. These are general features found in every case of infection. So just analyze. If these features are present, then there is a case of infection. Now, very important sign to get confirmation that patient is having cholelithiasis, that is gallstones. Just ask patient to take the deep breath, deep inspiration. So during that period, just press or apply pressure with your 3 fingers on the abdomen, that is on that area, right hypochondric region. Just apply the pressure with the 3 fingers here in the right hypochondric region. So during that phase, when patient will take deep breath, he or she will have a severe pain. So that is the confirmatory sign, and that sign is known as Murphy sign. Murphy sign. That is the confirmatory sign for the gallstones. So always remember that in case of cholelithiasis, in case of gallstones, there is typical character of pain, and that pain usually occurs in the right hypochondric region, and that get transfers into the back or in between the shoulder blades, and that pain generally occurs during the night time when the patient is in supine position, because stone will block the gallbladder and will block the cystic duct and the neck of gallbladder. That will cause spasm of the gallbladder, and that spasm will cause pain, that colically pain. That pain is called biliary pain. Now investigations. There is leukocytosis, that is increased WBC. Then plain X-ray is very important, and this will identify the radio opaque shadows of the stones. So it will identify the opaque stones. There will be radio opaque shadow seen. Now ultrasound is the very important investigation in case of cholelithiasis, because it will identify both opaque and radiolucent stones. So both can be seen in ultrasound of the abdomen. Also it can identify the biliary sludge. Biliary sludge. Sometimes it becomes difficult to identify biliary sludge because of the lot of gas or ascites if patient is having gastric trouble or ascites. In that condition, it becomes difficult to identify biliary sludge. Beside this, CT scan. Then blood sugar and urine sugar is also done. So sugar levels are checked, both of urine and blood. WBC increases during the phase of infection. And beside this, the other investigation you can recommend patient is radioactive isotope scan. So radioisotope scan you can also recommend. So these are the investigations. In treatment, if the patient comes, many times the patient doesn't have any complaints, there is asymptomatic, so patient will not come at that time. So patient will always come when he or she is having the severe pain. So there is conservative treatment. If the patient comes in an emergency and there is fever, there is imbalance of vitals, vitals are not normal, so first give the IV fluid. So IV fluid is given, intravenous fluid is given, they normalize the sugar levels, normalize the blood pressure, everything. This is the conservative treatment. Then in medical treatment, medicines are given that will inhibit the process of nucleation of the cholesterol. So the medicines are given to inhibit the process of nucleation of cholesterol. So there will be no formation of cholesterol crystals and stones. So the medicines are given. Then in surgery, there are two ways of cholecystectomy. Cholecystectomy is removal of the gallbladder. So in surgery, cholecystectomy is done. Cholecystectomy is done, that is gallbladder is removed. So we will remove the gallbladder. So has two types of procedure. It can be done open, that is open cholecystectomy done when the incision is given. So the recovery rate is longer. Recovery will take time. So recovery time is longer because the open cholecystectomy is done by the incision, by giving incision, or it can be done by laparoscopic. So there are two ways. In laparoscopic, key and hole surgery is done. Key and hole surgery is done. So here the recovery rate is faster. So recovery is fast here and here it is slow. In case of open cholecystectomy, when the gallbladder is removed by giving the incision in that area. Then beside this cholecystectomy, the other way is ERCP, where the endoscope is used to remove or to basket out the gallstones from the gallbladder. So in surgery, the ERCP is done where the endoscope is used to remove the gallbladder stones, and the cholecystectomy is done when the gallbladder is removed either by giving the incision, that is open cholecystectomy, or by using a laparoscopic method, that is keyhole surgery. Now gallbladder has only the one function, that is the storage of bile. So it doesn't affect digestion if the gallbladder gets removed. So this is the gallbladder. There is duodenum here and this is the liver. So this gallbladder only stores bile, and that bile contains what? Bile pigments, bilirubin and the minerals and some cholesterol. So it generally only does one function of storing bile. So there is no other function played by gallbladder. So gallbladder, if get removed, so it will not affect the digestion of the patient. So that function is also played by there are liver canculi or liver canals. So this liver canals also store bile. So if the gallbladder is removed, the same function can be done by the liver canals, also known as bile canculi. Now the medicines given to inhibit the process of neutralization of cholesterol are also deoxycholic acids and deoxycholic acid. So this both medicines are given, also deoxycholic acid and deoxycholic acid, to inhibit the process of neutralization of the cholesterol. So that neutralization of the cholesterol will be inhibited. So the crystallization will not occur. Cholesterol crystals will not form and then the stones will not form. So this is the medical treatment. In conservative treatment, if the patient comes with a fever, if there is fever, so the antipyretic medicines are given to control the temperature and antibiotics are given. So if there is fever, in case of fever, antibiotics are given. Antibiotics depend on the causative organism, gram negative or gram positive, aerobic or anaerobic. So the antibiotics are given on that basis. So blood culture and urine culture is first recommended to the patient. And antispasmodics are given to relieve the spasm, to relieve the pain. So the antispasmodics generally are given morphine and atropine. So the injection of morphine is given, and beside this other painkillers, analgesics are given. Analgesics are given to relieve the pain. So antispasmodics, antipyretics are given. Antibiotics are given if there is infection present, if infection is persist. Medicines are given to inhibit the process of nucleation, and surgery is the last option where the cholecystectomy is done, because when gallbladder will get removed, so it will not affect the digestion of the patient, because the same function, that is storage of the bile, is also done by the liver canals known as bile cancelloi, and the cholecystectomy, that is the removal of the gallbladder, is done by two processes, either by open surgery or by laparoscopic surgery, where the keyhole surgery is done. ERCP is done where the endoscope is used to remove the stones from the gallbladder.